Okey. Alright, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Saya harap semua boleh dengar suara saya dengan jelas. Boleh ke? Ah,
Boleh, boleh.
sekejap Termute ke? Okey, boleh kan? Sekejap saya tak dengar.
Jelas.
Tak dengar ke? Kita orang dengar.
Okey, dah dengar. Okey. Alhamdulillah, saya pula tak dengar tadi. Okey, alright, alhamdulillah. Okey, pertama sekali yang berbahagia Dr. Siti Nuryati, Binti Cik Ya, speaker kita pada malam ini dan juga rakan-rakan puteri sekalian. Terima kasih kerana sudi hadir pada malam ini. Manakala malam ini malam minggu, esok akan mula bekerja. Tapi puteri semua masih sudi nak menambah ilmu pengetahuan dengan hadiri Cakne Talk pada malam ini. Okey, sebelum kita memulakan majlis, mari kita sama-sama membacakan surah Al-Fatihah. Bismillahirrahmanirrahim. Amin amin ya rabbal alamin. Okey, untuk pengetahuan semua, ini merupakan Cakne Talk kali ketiga lah yang kita buat untuk tahun ini. Sebelum ni kita pernah buat topik palliative care dengan Dr. Siti Munirah. Lepas tu ada I think awal tahun sebelum ni pada buat tapi I think that one under previous exco. Kita nak kenalkan dulu speaker kita Dr. Siti Nuryati pada malam ni. Okey, sekejap izinkan saya membacakan sedikit biodata. Okey, Dr. Siti Nuryati ni daripada batch SPM 99. Saya rasa ramai batch SPM 99 malam ni yang yang dikatakan akan menyokong Dr. Siti supaya tak tertidur katanya. Dr. Siti ni dia tidur awal. Okey. Sekejap saya dapatkan CV doktor. Doktor dah hantar kat saya sebelum ni. Okey. Doktor kita ni sekejap okey. Dr. Siti Nuryati Binti Cik Ya is a dedicated family medicine specialist with over 8 years of experience in primary healthcare. Born in suburban area of Kelantan in 1982, orang Kelantan. Okay, she attended secondary education in SSP KL from 95 until 99. Dr. Yat then earned her medical degree from Monash University in Australia in 2008 and completed her specialty training in family medicine at the University of Science Malaysia in 2020. Okay, being a family medicine specialist, she is committed in promoting wellness and preventive care in diverse communities. Dr. Yap particularly passionate about chronic disease management and health literacy, believing that informed patients make the best choices for their health. In addition to her clinical work, she is also a member of development group for clinical practice guideline KKM and NCORT certified basic life support instructor. Her special interest is in pre-hospital services in primary care health. Okay, outside of medicine, Dr. Yas was blessed with 2 boys in her family and has developed another special interest in her life to become a vet advisor for goal saving. Okay, so siapa yang berminat untuk menyimpan emas bolehlah lepas ni ketik Dr. Yat. Okay. Sebelum tu saya terlupa mungkin ada yang belum kenal saya atau saya dah biasa tengok saya. Saya Zilda Liana, saya dari batch 2001. Host anda lah pada malam ini. Saya merupakan exco lah untuk 2024 hingga 2027. Okey, tanpa membuang masa, sama-sama kita jemput Dr. Siti Nuryati untuk menyampaikan Cakne Talk yang bertajuk Beat Cancer, The Importance of Early Screening. Dipersilakan.
Okay, bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Thank you so much to Zelda for the kind introduction, and thank you also to Puteri Exco and Puteri Cakne for giving me the chance the opportunity to share some essential info about cancer screening, because apparently not many are aware about cancer screening in our society. So allow me to share my slides first. And okay, nampak tak?
Nampak.
Okay, wait Let me start show. Okay, my audio chat pun okay, clear.
Okay,
Okay, so
doktor, clear.
okay, so now so here I am giving you a talk about bit cancer, the importance of early screening. So my apology because my slides ni will be mixed in Malay and BM and BI based on the references that I go through. So tak jalan.
Kenapa doktor tak boleh? Next.
So I kena
Okay.
Okay, so this is a bit about me. I'm a kampung girl from Kelantan. I was fortunate to go to Sekolah Sri Puteri, and after that, I went to do international baccalaureate, and after that, I completed my medical degree in Monash University in the year 2007. And after years of service in both emergency care and also primary healthcare, I then completed my specialty training in family medicine in University of Science Malaysia in the year of 2020 during COVID epidemic. Dia tak nak bergerak. Okay, next, this is my short stint experience, the 4 years experience being a family medicine specialist. Of all the 3 places that I served, the most memorable and experience for me is doing giving services in klinik kesihatan Kuala
Tapi
Betis,
tu yang babak
where
punya
it
yang
is
tak sikit tu. Yang lain tu yang ada.
oh, someone can please mute. So this is a rural area where I serve orang asli settlement in Gua Musang, Kelantan. And this picture is actually me and my team. We did a mobile clinic services to the community deep in the jungle. And we are actually dekat Rumah Sewang, which is the place where orang asli seek a traditional medical healer. So here we are giving services to the community. I believe some of us are not quite familiar what is a family medicine specialist and what is their role in our health services. So we are actually specialized in primary health care, where our services starts when the baby is still in the womb, right until they are on the last day of their right until on their last day of in their life. So so this is me. Our job is mainly to provide promotion. We also specialize in giving preventive care, and we also provide treatment, rehabilitation, and also palliative care. So that's why for the cancer screening, it is one of our bread and butter services in primary healthcare. Okay. Now going back to our main discussion for today, this is the outline of our discussion. First, I will share some information about cancer screening, and then I will address some of the frequently asked questions about cancer screening. And after that, I will also highlight the myth about cancer screening and also some experiences shared by others about cancer screening. And finally, our take-home message. So what is cancer screening? It is actually a process to check for cancer in asymptomatic individuals. So kita recall balik our biology class. This is what happened to healthy tissues that goes into genetic changes that progress into cell cancers and eventually leading to malignant tumors. And not only that, if it is left untreated or delay in diagnosis and treatment, not only it is cancerous to the organ, but it also spread to the other organs. It metastasized to other organs such as gastric, hepatic, pulmonary, and other organs. That's why it is important for us to detect cancer before it develop into malignant tumor and before it metastasized to other organs. Okay, why we need to do screening? Again, it is to early detect of the cancer, and it is actually a proactive action to improve the outcomes and also chances of recovery. As we can see, this is what we call screening, where we are screening asymptomatic populations, and then we detected those with positive findings or positive results of the screening. We subject them to the diagnostic confirmation, and not only we diagnose those who have cancer, but we also can diagnose those who are at high risk of developing cancer, such as those who had carcinoma in situ. Okay, this is different than if we are doing the usual practice where we only wait for our patients to develop symptoms, then only we do the diagnosis confirmation, but the services is only provided for the people with symptoms, but we miss those who are at high risk as compared to those who did the screening. Okay. Sorry. Okay, next. So where can we get our cancer screening tested? First, you can always go to any clinic kesihatan where we provide free services of cancer screening. And if you want to look for other options, you can also go to private health practices. And there are some actually NGO that provide cancer screening. For example, Smartna that provide mobile mammogram. And how do we test for cancer screening? It varies from cancer to cancer. Some may need tissue samples, some may need to go for imaging, some will do blood tests, and also even we take 2 samples to detect for cancer. And who we need to do cancer screening? It's basically, again, asymptomatic general population based on the age, gender, and also risk factors. So the keywords for cancer screening is actually asymptomatics. So this is actually the list of cancers that can happen to any of us. So the question is, which of these cancer that we can do screening? Is this all has a screening for us to detect it early? The answer is unfortunately no. There is only very limited cancer that can be detected through screening. So we will discuss the top 3 that are available in our settings for the cancer screening. So first is breast cancer, and coincidentally actually bulan Oktober ni adalah bulan kesedaran kanser payudara. Okay, I wish to highlight that breast cancer is the most common cancer among women in Malaysia. If we have 23 audience in our group, 1 is actually at risk for developing cancer. And unfortunately, 50% of Malaysians diagnosed before 50 years old. And more alarmingly, with this data, as you can see, more than 50% actually detected late. Stage 3, stage 4 tu dah kira lambat. And 50% are detected at stage 3 and stage 4. Okay, when we talk about risk factors for cancer, we need to identify which is modifiable and which is not modifiable. For the non-modifiable, it includes age, gender, which is female, family history, early menarche, which is less than as early as 12 years old, and also late menopause, which is after 50 years old, and also history of neoplastic disease of breast. So this is the non-modifiable, something that we cannot change. But this is the risk factors that we can modify. Being nulliparous, lacking breastfeeding, history of taking oral contraception more than 10 years, being overweight and obese, and also radiation exposure. These are modifiable risk factors for breast cancer. Okay, this is something that I would like to highlight. Although this is not part of cancer screening, breast self-examination is not cancer screening, but it is the earliest proactive measures that we can take as a person ourselves. It creates awareness and it creates health literacy among us. So once we reach age 30 years old, we need to do breast self-examinations. It needs to be done every month, 2 to 3 days after period. What we need to do, we need to examine the breast and armpits with raised arm using our finger pads that we put massage oil or shower gel. So there are 3 motions that we need to do: up and down, wedges, and also circular motion. And then we also need to examine the breast in the mirror for lumps or skin dimpling. And also we need to look for any change in skin color or texture, and also any nipple deformation, color changes, or leaks of any fluid. So hopefully after this, any one of us yang dah reach 30 years and onwards, we do this breast self-examination every month so that we can detect early for any changes. Okay. What about breast cancer screening itself? This is from our guidelines, local guidelines recently published about breast cancer screening. So what happened when you go to clinic, what we'll do is we will examine you first, and then we will ask for any risk factors. If you don't have any risk factors, then you will need to do the mammogram after 50 years old. But if you have any risk factors, then the management is different. Okay, so what are the risk factors? Okay, you just need to have only one of these risk factors to be considered as high risk. First, sejarah peribadi kanser payudara. So personal history of cancer or carcinoma in situ. Second, mutation BRCA. This is a genetic mutation that you might have been tested before. So if you are positive for BRCA1, then you are high risk. Third, sejarah radiasi for usia muda. For example, if you have lymphoma, then you go for radiotherapy, then you are at higher risk. Next, if your first degree is a carrier of BRCA and you are not yet tested, then you fall into high risk category. And then if you have family members, regardless whether first degree or second degree relative that has ovarian cancer or breast cancer, if you have any of this, then you fall into high risk group. Then we need to go for mammogram. Otherwise, you just need to wait for until you reach 50 years old, then only you do the mammogram. Okay, this is the common scenario. This is the scenario that you might presented yourself to the clinic. So you might be saying, I am 49 years old and I have no symptoms. I never received radiotherapy and none of my family members ever had breast cancer or ovarian cancer. At this point, the doctor will plan for you to do mammogram every 2 years, starting from 50 years old. But we do remember from my previous slides that up to 50 years old of Malaysians diagnosed with breast cancer before the age of 50. So that's why in our guidelines, mammogram as early as 40 years old can be done upon patient's request. Okay, the next scenario, who is at high risk, when a client presented to us, I am 40 years old and I have no symptoms. However, my cousin was just diagnosed with breast cancer this year. So you fall into high risk category and you need to do for mammogram every year, starting from 40 years old until age 59, then every 2 yearly until age 74. This is the jadual kekerapan that we doctors in clinic will refer back if you presented to us in either of the scenario. So for the population arm, majority of us, we need to wait until 50 years old, then we will do mammogram every 2 years. But if you are high risk, we might consider doing mammogram starting 30 years old. And then after that, at the age of 40, we need to do it yearly until age of 60, and then 2 yearly until the age of 74. Okay, so this is mammogram. It is a breast cancer screening. What we'll do is most of the places, we need to do appointment to do mammogram. Only certain places that you can just walk in and request for mammogram. And then we'll place your breast and in between the machines, and then we will take the image of your breast to identify if there is any abnormalities or red flags within the image. Then we will give the reports to you, and then subsequently we will decide whether you need to go for diagnostic test or not. And then this is as mentioned before, other than hospitals, Makna also provide mobile mammogram, especially for those who live in rural area, far outreach area. Then you can actually make appointment to do this during the mobile mammogram. So if your mammogram tested positive, then we will subject you to diagnostic test, which is ultrasound guided biopsy. So we will take some tissue biopsy and we will examine and we will confirm whether you do have cancer or is just a false positive results from the mammogram. Earlier, I mentioned about doing breast self-examination. So these are the things that you need to look. These are the red flags or the sign and symptoms of breast cancer. First, when you feel for your breast, you will feel for any thick area. And then you look, is there any dimpling or any nipple crust around your nipple? And does your breast feel warm and red? Is there any nipple discharge? Or do you feel skin soreness? And then you feel for any bump, any growing vein, any sunken nipple, any new shapes or size, any orange peel skin, which is the dimpling of the skin, and the most obvious is the hard lumps. If you have any one of these red flags, you do not need to go for screening because you need to go for diagnostic test straight away. So we will subject you to the tissue biopsy because you are already having the symptoms. Remember, for the screening, we focus on the asymptomatic population. Now, the second cancer that we can do screening is colon cancer. Again, colon cancer is the second most common cancer among women in Malaysia. If we have 62 in our groups, one is at risk for having cancer. And it is highest in Chinese, followed by Malay and Indian. And it is an alarming fact that the percentage of colon cancer being diagnosed at late stage, which is stage 3 and 4, is up to 74%, even though we do have the screenings. So first, we need to know, again, the risk factors for colon cancer. These are the risk factors that we cannot change, which is age, family history of colon cancer, any radiation exposure, personal history of polyps or colon cancer, and inflammatory intestinal condition. But there are risk factors that we can change, such as physical activity, being obese, type 2 diabetes, smoking, and also dietary habit. Okay, when we talk about cancer, as I said, from the normal tissue, first it goes into benign. And after that, some will go into severe dysplasia, which is the precancerous polyps, and eventually it grows into adenocarcinoma and develop cancer. So our screening doing fecal occult blood is to detect the severe dysplasia, the precancerous polyps, and also the early stage of cancer before it progresses into severe and becomes metastasized. So what we'll do for our first screening for colon cancer is to do fecal occult blood. Okay, this is the practical part. Okay, I know it sounds a bit not so fun lah. Tapi what we need to do is we put some paper on top of our toilet bowl, and when we poop, then we put just a small amount of sample, small amount of our poop into the container, and we give to the lab. Other than that, the second screening for colon cancer is colonoscopy. So which patient that need to go for stool occult blood and which patient that need to go for colonoscopy? Okay, here are the situation. If you are 48 years old and you have no symptoms and none of your family members ever had colon cancer, then you need to do fecal occult blood every 2 years, starting from 50 years old until 75 years old. Previously, we subject our client to do annual fecal occult blood, but starting from our latest guideline, we do it every 2 yearly. And then if you come to our clinic and you said you have no symptoms, but my first degree relative had cancer before 60 years old, then we will plan for you to do colonoscopy at the age of 40 or 10 years younger than affected relative, whichever is younger. If your colonoscopy is normal, then you need to repeat every 10 yearly until 75 years old. And the third scenario is okay. Is when you come to our clinic and you say you have no symptoms, but my family had cancer before 50 years old, previously 60 years old, and this one is 40 years old. For family history before age of 50, we will plan for you to do colonoscopy at the age of 40 or 10 years younger than affected relative, whichever is younger. And if your results is negative for colonoscopy, we need to repeat earlier, between 3 to 5 years until 75 years old because of the age onset before 50 years old. Next, you need to know what are the red flags or signs and symptoms of colorectal cancer. The most common are changes in bowel habit. Basically, you have alternate. Sometimes you ada diarrhea and then you jadi constipation. Sometimes, ataupun you boleh dapat chronic constipation. That is a clue for colon cancer. Second, you presented with blood in stools and also mucus in stools. And sometimes you may present it with persistent urge to pass stools. Basically tenesmus, meaning that you dah membuang tapi you rasa tak puas, rasa nak membuang lagi dan lagi dan lagi. And also you may present it with chronic abdominal pain. So these are the red flags, alert for colon cancer. And what you need to do, you need to come to our clinic immediately because we need to arrange for colonoscopy. There is no more stool occurred blood for you because you already developed symptoms. We need to do diagnostic test. So colonoscopy is basically we put a scope through your anus, and then before that you need to do bowel prep to make sure your bowel is empty, and we can put the scope and we can visualize is there any abnormalities along your colon. And third cancer screening that is available for us is cervical cancer. So aptly, cervical cancer is the third most common cancer among women in Malaysia. Out of 154 in a group, there's one that is at risk for developing cervical cancer, and 95% of cervical cancer is due to high-risk HPV infection, human papillovirus infection. And again, I would like to highlight that the percentage of late diagnosis in cervical cancer is also up to 50% late diagnosis. So to understand about cervical cancer screening, you need to understand the progression. So what happened? Once patient having who are sexually active, and then they will start at risk of getting HPV infection. And HPV infection is an oncogenic infection where some of the HPV can progress and develop high-grade abnormalities, who is higher risk to develop cancer. So there are two cancer screening for cervical cancer. Previously, we did pap smear. Pap smear is basically to detect cell changes after they occur. But now with our advancement, we are doing cervical screening test where we detect HPV even before the cell changes occur. So we are basically screening as early as the HPV infection. We are not waiting for the cell changes anymore. So what are the risk factors for cervical cancer? It basically revolves around the risk of getting HPV infection. For example, those who marry early, those who are sexually active at younger age, those who having multiple sexual partner, poor genital hygiene, smoking, multiple pregnancies, weakened immune system, such as having any immunocompromise, including HIV, and also use of oral contraceptive pills. For cervical cancer, there's only one scenario where you presented to us and you have no symptoms. So for this, we will subject you to do pap smear yearly for 2 years and then 3 yearly, starting the age of 35 up until 65 years old. Or the second option is if you want to do HPV test, which can be done every 5 years from the age of 35 until 65 years old. So these are the two options. If you have no symptoms, we will start doing the cervical screening starting from 35 years old. So for the pap smear, this is how we will do the pap smear. Basically, we will put a speculum into your vagina, and then we will take some samples at your cervix. And this is for the HPV test. The good news is for the HPV test, it is a self-test. Even I did my HPV test for myself. So this is how you're going to do it. Basically, you just insert the swab through your vagina up until you can feel the resistance. And then you rotate for 10 times. And then you just remove the swab and put into the packaging. That's all. And if your screening test for cervical, whether HPV or pap smear is positive, then we will subject you to diagnostic test, which is colposcopy. It's basically, we will examine your cervix, and then if there is abnormalities, we will take tissue samples to confirm whether it is cancer or not. What about the red flags, or what are the symptoms for cervical cancer? Patient usually presented with unusual vaginal discharge. Don't be alarmed because vaginal discharge is very common actually among us kan. Tapi if you detect something unusual, foul smelling or more copious, then you need to get yourself checked. And the other common symptoms for cervical cancer includes pain during sex, having extreme fatigue, postmenopausal bleed, lower back pain, and also more commonly bleeding, either during or after sex or between periods. So when you presented to us with these red flags, again, we are not going to do pap smear or HPV because you already have the symptoms. We will subject you to colposcopy for diagnosis. Okay, I'm done with the top 3, not only top 3, but these are the only cancer screening that is available at the moment. So now we are going to discuss about the top 3 frequently asked questions about cancer screening. What happened? Sorry, I cannot see. Yeah. What happened if a screening test is positive? This is the most common question being asked to us. So you need to remember that a positive result doesn't mean you have cancer. It requires further diagnostic tests to confirm a diagnosis because screening test is not 100% accurate. There is a small chance that it can be false positive. That's why do not be alarmed, do not go into anxiety. If your screening test is positive, please follow our plan to do diagnostic test so that we can confirm whether it is really cancer or it's just a false positive results. The second FAQ, are cancer screenings safe? So the answer is most cancer screenings are safe and involve minimal risk. Some procedures may have side effects. For example, pain from doing pap smear. You can also have pain doing a mammogram and also colonoscopy. But the benefit far outweigh the side effects. So you have to consider doing cancer screening. And some of the procedures also require follow-up tests. And the third popular question is, how do I prepare myself for cancer screening? There are 3 things that you have to do. First, you need to gather medical history, not only about yourself, but more importantly, about your family history. As we can see from our previous discussion, family history plays a very important key factors to decide what or which of the cancer screening that we need to go to. Second, you need to understand the test. You need to understand that this test is only a screening. And if it is positive, you need to do another test to diagnose. And also the third is you need to follow the pre-screening instruction. This is particularly important for colonoscopy, where you need to do bowel preparation to empty your bowel. And also for pap smear and also HPV, where you are not allowed to have intercourse, you are not to put any pessaries before you do the pap smear because it will affect your results. Next, I would like to highlight about the common myth about cancer screening. So the first myth, some people believe that if I don't have any symptoms, I don't need to get screened. When the reality is cancer develops with no noticeable symptoms at early age. That's why we develop screening tests to detect the cancer before symptoms appear. The second myth is, if no one in my family has had cancer, I don't need to get screened. But the reality is most cancers are not caused by inherited genetic mutations. As we can see, majority of people with cancer do not have family history of disease, but they have other high-risk factors such as age, lifestyle, and also environmental factors. And the third myth is screening is harmful and increases cancer risk due to radiation. It is mainly about mammogram, but rest assured that the amount of radiation are very low and are considered safe. What you need to remember is potential benefit of early cancer detection far outweigh the minimal risk posed by this radiation exposure. So do not be scared to go for mammogram. And the next information that I would like to share is about this is a sharing experience. I look into literature. How do actually our Malaysians perceive of cancer screening? And I found a qualitative study. This study basically explore the Malaysians cancer patients' perception of cancer screening before them being diagnosed as having cancer. These are the important quotes that I would like to highlight that might resonate, that might be relatable to some of us. 1% actually said that when we are healthy and go to see the doctor just for fun, it will be embarrassing, right? So this is the perception that they need to have the symptom first before they get before they go for cancer screening, which is the opposite of our screening. We want to detect cancer before we have the symptoms. When we are healthy, but when we are healthy, but we are actually at high risk, that is the best point for us to get screened and to be diagnosed. The second quotes that I would like to highlight is, yeah, I have heard of it pap smear, but I ignore it. I ignore it as everything comes from Allah, God in Muslim belief. So this is another fatalistic belief that cancer is not treatable. It's like you cannot treat cancer. So apa-apa pun redha je lah. But it is contradictory to our Islamic religion. We need to take action before we bertawakal. And we know with early intervention, with early diagnosis, cervical cancer or any cancer is treatable. So this is another myth or misconception about screening. And the next quotes that I would like to highlight. Yes, my father at the age of 63 and my younger sister at the age of 20 years died of colon cancer, but I never thought of getting cancer because I was healthy all the time. This is the myth or misunderstanding about the susceptibility of getting cancer, even though he knows that he is high risk because his family members both died of cancer. But just because he's healthy, he doesn't think of getting screening. And finally, there's one person that said, I don't know about cancer screening. I heard about breast cancer, but since it wasn't of interest of me, I ignored it. So this is actually relatable to some of us who are maybe younger age, maybe you are just above 20s or before 30s, but you know about mammogram, what you need to do actually, even though you are not at high risk or you don't need to go for the screening yet, but you need to spread the information. You need to alert your family members, maybe your mom, maybe your sisters to go for the screening. And finally, my top 3 take-home message is, first, cancer screening is to detect cancer in asymptomatic persons. So I really would like to highlight that we want to detect as early possible for cancer. So we need to do so when you do not have any symptom yet. And second, early cancer detection will increase a chance of recovery and survival. And finally, do not let myth about cancer screening stop us from getting the test. So that's all for my sharing about cancer screening. Feel free to contact me through my social media. And so that's all. Is there any question?
Okay, Alhamdulillah, thank you, Dr. Siti Nuryati for the very beneficial sharing. So now I open question and answer from the audience. Ada tak siapa yang
Alamak,
nak tanya boleh?
tak clear.
Tak clear? Hello? Memang tak clear? Sekejap. Hello,
Ada soalan
jelas
tak?
ke? Boleh buka mic and also atau tulis kat chat.
Zelda, your suara putus-putus.
Putus-putus. Oh, okey. Macam mana? Testing. Putus-putus lagi ke? Masih Oh, dengar suara Zelda clear.
I dengar suara Kak Zelda clear.
Oh, maybe your line good. Tak apa, kalau ada soalan boleh tulis dekat chat ke untuk doktor bacakan?
Okay lah.
Okay. Dua-dua clear. Oh, okay.
I tak tak berapa clear soalan Zelda punya voice, tak apa. If there is any question you can just ask or just type in the chat.
Kak Munira nak tanya ke?
Nak cakap ke nak tulis? Boleh dengar ke?
Boleh.
Kak Yat dengar ke suara Kak Munira?
Dengar tak?
Tak dengar.
Rasa macam tak dengar saya type kejap.
Okey. Oh, okey Kak Yat tak dengar.
Ini apa namanya roket?
Okey, sementara tunggu Kak Munira type soalan, kalau ada orang lain pun nak tanya boleh type juga soalan. Manakala soalan Kak Munira, kalau ada yang diagnose dengan kanser, adakah sistem sokongan in our healthcare system at present?
Okay, so for the thank you for the questions of support system. For those who are diagnosed with cancer, there are support systems provided. Basically, they are being provided for each. From my knowledge, the support system is being provided by the specific organisation. For example, kalau breast cancer, dia memang ada dia punya breast cancer organisation punya NGO that provide support group. Tapi I cannot recall the exact names. Other than that, we do have, if I'm not mistaken, ada IKN, and then that's about it lah. Okay, next question by Adri. Colonoscopy and colposcopy procedure painful? Is any anesthesia given for the procedure? I have to be honest that colonoscopy and colposcopy is quite can cause discomfort lah. Nak kata painful sangat tu tak juga, tapi yelah, it cause some discomfort, but for colonoscopy usually we do not give any anesthesia. Sama juga macam colposcopy pun kita tak bagi anesthesia lah before the procedure. Okay. Okay. And then for the colonoscopy, only kalau macam some patient tu memang kalau dia betul-betul tak boleh nak cooperate, sangat tak boleh nak tolerate, kita akan bagi jugalah some low dose sedation, but usually memang tak bagilah anesthesia. Okay, tapi tengoklah from patient to patient. Some patient kalau memang tak boleh nak cooperate, memang kita bagilah some sedation, low dose sedation untuk colonoscopy. Tapi kalau colposcopy, basically colposcopy ni sama je macam pap smear punya procedure. Dia masukkan speculum to visualize our cervix and to do examine using a microscope. Kalau colposcopy memang kita tak bagi anesthesia lah. Okay. Unless kalau dia nak buat some procedures, that one memang kita bagi anesthesia, local anesthesia. Okay, next question. Just to confirm, screening memang ada untuk 3 jenis kanser, breast, colon and cervix. Yes, the answer is kalau untuk female, memang ada 3 ni je yang memang kita kata recommended. Because the other cancer screening sebenarnya not recommended, tapi ada some private practice yang kata this is part of cancer screening. Tapi sebenarnya from the guidelines, these are the 3 cancer screening yang memang recommended and memang ada good accuracy. Sebab tak semua screening, tak semua cancer kita boleh buat screening. Kadang-kadang dia menyebabkan lagi banyak side effects, lagi banyak false positive. Is it normal nowadays to not have symptoms then tiba-tiba detect level 4 cancer? Okay. The answer. Okay, the answer Okay, the answer is kadang-kadang memang kalau depends on the location of your cancer. For example lah, even kalau breast cancer pun, kalau you punya lumps or your cancer tu dekat surface where you can palpate. Kalau you younger age pun, kalau sebab sekarang ni memang kita tengok banyak yang younger age as early as 30, 40s pun dah dapat breast cancer. Kalau you punya cancer tu dekat surface area, then you bila you feel, then you seek treatment, then you mungkin akan detected awal. Tapi kalau contohnya you punya cancer tu dekat deep inside, and you pula tak pergi buat screening, then tu yang high chance untuk you dapat level 4 cancer. Okay. Next, blood test yang untuk detect cancer tu consider as screening ke? Okay, from my knowledge, blood test yang memang kita consider as cancer screening is only for prostate cancer, the one yang kita do PSA. Yang lain-lain tu yang kita panggil tumor marker tu, that one is actually for those who has been diagnosed with that cancer. And then we do the tumor marker tu to monitor the progress. It's not to detect or to screen for the cancer. Next, current HPV immunization program for secondary school girls. As parent, is it okay not to give permission to our daughter to get them as they are not sexually active? Are they really effective to be getting them at the very young age to prevent cervical cancer once married in the future? Okay, as a general, before KKM decide to implement something, some immunization, some programs, we went through a vast research and we really scrutinize whether it is really necessary or not. So my advice, if it is recommended by our KKM, it is actually for the best interest of our kids. So even though we know that maybe our kids are not sexually active, 16 years old, kita rasa tak sexually active, tapi in other populations, in other some marginalized population, they are already sexually active. That's why we cater for all. And as I've mentioned dalam my previous slides kan, HPV tu yang the culprit, the causing the 95% of the cervical cancer. So if we have the vaccine that can prevent our kids from getting cervical cancer in the future, even though they later on they get married and then they did get HPV infection, but since they have already received the vaccines, they are protected from cancer. So why not? So that's my my point of view lah. Okay, so kalau ada yang nak cari for info screening selepas ni, ada ke website yang baik sebagai rujukan. Okay, for as a general, sebenarnya dekat KKM pun dia dah sediakan satu portal My Health. I kena recall balik, dia portal.myhealth rasanya. That one dia memang ada some information lah about cancer screening. Kalau nak cari yang lain-lain mungkin ada juga dekat Makna. Okay, yang I jumpa tu dekat Makna lah. Yang tu pun ada juga bagi information about cancer screening yang local based. Tapi kalau yang KKM pun memang dah ada dah. Portal.myhealth. Okay, macam mana nak detect gene yang mutate for breast cancer tu? Is it recommended for high risk individuals? Okay, genetic test yang BRCA tu, that one you kita ada checklist. Those yang fulfill the checklist, the one that we recommend to check to get it checked lah. Because for genetic mutation punya test tu in our government clinic, kita tak provide, kita tak offer. Kalau dekat hospital pun, biasanya surgeon yang care for the breast cancer patient tu, dia akan go through the checklist and then only they recommend to get it tested. Next, would taking HPV vaccine at the age above 40 still be useful, or is it considered late? Actually, for the vaccine, it is considered late to be taking after 40 years. That's why we want them to be taken as early as before they are sexually active actually. Okay, cancer screening ada yang covered by takaful ke kalau private? Okay, this is unfortunately beyond my knowledge about cancer screening for takaful. Maybe some of us yang takaful agent can provide some information. Cancer screening covered tak by takaful kalau private? I'm sorry, I cannot give you the answer, but I believe some of us yang takaful ada some info about takaful, boleh share.
Ada takaful agent ke kat sini yang boleh share? Normally
Sebab
macam yang I faham, kalau kita diagnose, macam kita screen and then diagnose, dia akan cover lah dia cost. Tapi kalau kita tak positif, tak ada cancer, kita tak boleh claim balik lah. Itu yang I faham lah daripada medical card. Yang I tak sure kalau orang lain boleh ada some knowledge or info. Okay.
Itulah. I pun tak aware pasal takaful covered sebab I rasa kalau screening usually takaful tak covered sebab takaful ni biasanya dia akan fokus kepada yang life threatening, yang fatal punya condition, then only di cover. Okay, but for everyone's information, for our KKM services memang kita bagi free lah. And then next question, how do survival rates differ between individuals who detect cancer early versus those who detect in later stage? So in general, the survival much improve kalau we detect the cancer early, as I cannot really recall the figures lah. Tapi kalau contoh kalau you detected at stage 1, your survival is up to 80%. Kalau untuk breast cancer, for example, as compared to kalau you dah detected at late stage, stage 3 or even worse, stage 4, your survival may go down up to 10%. Okay. So thank you Ida sharing your experience. Hospital swasta covered for mammogram, ultrasound and biopsy kalau warded. So Ida shared her experience of doing mammogram, ultrasound and biopsy. Kalau you nak covered, you get admitted to private hospital, then takaful will cover, kan? Okay.
Ada lagi soalan ke? Kak Yat dah boleh dengar saya jelas ya?
Dah jelas dah.
Okay, Alhamdulillah. Alright. So, Alhamdulillah banyak sangat soalan daripada audience kita. Ramai yang betul-betul nak tahu tentang screening and isu-isu kaitan dengan kanser ni.
Okay, ni ada satu from Kak Lily. I went for genetic test at HKL. Alhamdulillah, all is well. So Kak Lily shared her experience of doing genetic test. I believe the one yang BRCA ke Kak Lily? So itulah hospital. Some hospital do provide genetic test. Biasanya yang big major hospital lah.
Doctor, I went there for the whole the whole broad genetic lah. Semua di check colon and everything.
I see.
The reason being because of the family history. So they call all family members, anak buah and everything semua. So I just to share lah. Macam I have to pay, I cannot remember, 300 USD kan tu ke? Sebab again lah HKL dia cakap dia ambil tapi third party yang still buat. Cuma dia ambil the results semua and dia bagi tahulah. But then again ada some of family member yang like you said lah, dia ada genetic but it doesn't mean pun dia ada pun the cancer itself. So they went to macam colonoscopy, dia dah start lah. Tu saja. So tadi I think Puteri kot tanya, like you said lah, dia ada kriteria dia. So dia ambil the whole family history. My mom, my father kahwin dua kan. So my mom side, the other side semua. So untuk my mom side punya ni clear lah. So again lah, kalau betul ada like you said, you can ask the doctor lah. Tapi not free lah, kena bayar. Dekat
Betul.
dekat Institute Pediatric tu ada genetik punya test tu saja. I just want to
Okay.
share lah sebab tadi ada yang tanya kan.
Thank you so much. Thank you so much. Itulah sebab kalau kami di KKM ni, kalau I dekat klinik kesihatan tu memang we will refer to primary team dekat hospital, then only they will go through the list and decide who actually need to go for genetic test. Thank you Kak Lily for sharing your information. Okay, ada lagi last questions?
Last question dah. Dah nak menghampiri 10 PM. Ada lagi ke? Kalau ada nak tanya, buka mic ke sebab Kak Yat dah boleh dengar apa? Dengan jelas. Thank you Eri. Mudah-mudahan all sisters here and family Allah lindungi from getting any life-threatening diseases. Amin. Okay, kalau
Hopefully my last words is don't be scared to get screening lah. I know even I myself pun memang I ada family history of colon cancer and also breast cancer. So I am also preparing myself to do all the screening. So hopefully some will say that tak payahlah buat, tak tahu lagi bagus kan, tapi it will lead you to regret in later life. That's all for me.
Kak Yat lupa nak tanya. Kalau macam any family members, kita yang dapat kanser selain daripada 3 jenis kanser tu lah kan, yang mungkin ada tadi 3 jenis tu breast, cervix and colon. Tapi ada kind of lain, kanser lain macam kanser paru-paru ke, katakan kanser otak ke. So kita pun akan ada risk and memang tak boleh screen lah. So macam mana tu?
Betul. Itulah like I said, untuk kita recommend some test, we need to memang make sure that the test is good enough to be screening. Otherwise, dia akan cause false positive and then can also cause false negative and anxiety, unnecessary anxiety. That's why kalau macam cancer yang lain, unfortunately, at this point lah, kita belum ada lagi teknologi for us to do screening. So what we need to do is, kalau contoh our family ada risk of, memang ada history of macam brain tumor ke apa ke, then we need to get information what are the sign and symptoms. Kita kena tunggu, bukanlah kata kena tunggu ada red flags tu, tapi that's the only way kita boleh get ourselves tested early. Tapi untuk screening tu memang tak ada lah.
Okay, thank you Kak Yat. Okay, so Kak Munira kata boleh ajak sisters pergi, sorry, ada soalan, ada di komen sebelum tu, I've done breast and, sorry sekejap, ternaik atas pula. I've done breast and cervical screening a few times, a bit uncomfortable, tapi okay insyaAllah. Boleh ajak sisters Puteri pergi sama-sama so tak rasa risau sangat, or kawan-kawan family members tak perlu pergi. Yeah, it's a good idea. And mungkin boleh cadangkan dekat, it's a good idea juga, mungkin boleh kita Puteri pun mungkin boleh buat tak tahulah, program untuk early screening ke apa. Nanti we try to buat under Puteri Cakne lah. Okay. Thank you for the
Actually, kalau betul minat, sebab contohnya kami I mean the NGO I'm with, kita orang memang buat breast screening program.
Alright, that's good.
If interested, kita macam maybe kita boleh rent macam rent a place ke kan, kita buat, and then sebab dia datang dengan lori yang comfortable lah, dalam tu ada aircon, and dia boleh buat the whole process, dia boleh buat, kita boleh buat quite a lot of things. So kalau kita nak buat event khas for ni and invite Puteri, okay je, boleh.
Okay, InsyaAllah akan diajukan ke next meeting EXCO, InsyaAllah. Thank you so much. Okay, so kita dah pukul 10, 1 minit. So saya harap dah tak ada lagi soalan. Kalau ada mungkin boleh ajukan dalam boleh WhatsApp terus Kak Yat dia ada share tadi kan. Lepas saya rasa Kak Yat pun aktif dalam TikTok juga. Macam pernah nampak TikTok you lalu. Okay. So thank you so much to Dr. Siti Nuryati or Kak Yat for your very very beneficial sharing. Kalau you tak share malam ni, I pun tak tahu ada 3 je jenis screening. I thought that semua cancer ada screening masing-masing. Oh hi, will the slides be shared? Okay Kak Yat, nanti you share dalam nanti I share tu group
boleh, boleh.
WhatsApp batch rep. Nanti hopefully batch rep can share with you, Adri. Okay, so thank you so much, and I hope everyone here will get get tested ke screen, and then terima kasih sebab sudi luangkan masa pada malam minggu ni untuk mendapat boleh share this information to all your friends, family members. Sama-sama lah kita mengurangkan statistik kanser yang semakin membimbangkan kat negara kita, insyaAllah. So before I end the session, I nak share, Puteri Syafawati, you nak share ke on, I share screen.
Boleh share screen.
Okay.
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 So seperti yang semua tahu, so I just nak promote on the next alumni Puteri event lah, which is Puteri Picnic, akan diadakan pada 19 Oktober 2024 lah, iaitu lagi 2 minggu lagi. So diharapkan semua dapat datang dan kita boleh eratkan kita punya ukhuwah sebagai sisters daripada SSP lah. Okay, thank you.
Okay, boleh register ramai-ramai and boleh
Ni waktu ni kalau van tu datang okey lah nak periksa, tapi macam
you nak panggil ke?
tak lah 2 minggu.
Tak apa, nanti kita plan
Tak apa
ada
lah,
event
mungkin
lah.
like event kot.
InsyaAllah. Thank you. Okay, thank you Puteri. So ramai-ramai, jom kita ramai-ramai meriahkan piknik kita. Kak Yat dekat Kelantan jauh pula nak datang.
Itulah.
Okay. Alright. So kita akhiri.
Jom ambil gambar dulu nak? Tadi kat Dr.
Boleh. So semua hopefully boleh buka kamera. Siapa yang ready?
Kejap.
Sekejap saya stop sharing sekejap. Sekejap mana pula.
Last.
Okay. Siapa nak ambil Sekejap saya sekejap saya buat view gallery. Okay, so alhamdulillah dah ada yang buka video. Sekejap kamera. Sekejap saya tekan print screen. Okay, 1, 2, 3. Sekejap. Okay. Next page. Screen.
Mom, nah, I'm sorry. We will do.
Okay, sekejap another page. Nak Mami taking picture kejap. Okay, nanti I share insyaAllah.
Hi, teacher.
Okay.
Nama
Itu
saya apa?
saja buat masa ni. Thank you so much. Kita akhiri majlis kita malam ini dengan surah Al-A'raf dan tasbih kifarah. Oh ya, okay, thank you. Before I forget, sorry, this is last. Kalau ada sesiapa yang ada kena ahli puteri yang sedang mengalami kanser atau recovering atau sedang mengalami treatment ke, mungkin boleh suggest nama, boleh WhatsApp saya sebab saya ingat nak cari next speaker sharing on cancer lah. So sharing on recovery journey and all lah. Kalau ada boleh suggest kat saya Alright, itu saja. Terima kasih. Selamat malam.
Okay, thank you Kak Yat. Thank you Kak Zelda.
Okay.
Thank you
Thank you semua. Assalamualaikum.
Salam.
Thanks, Yat.
Thank
you. Assalamualaikum. Good night.
Good night.
Bye, Yat.
Well done, Yat. Boleh tidur.
Tahniah Kak Yat. Best.
Tak tidur.
Tahniah
tidur
tak
dah.
tidur.
Yat boleh tidur, Yat. Boleh tidur.
Yeah.
Okay.